Welcome to ATCM, the Emergency Medicine Channel. Today we are discussing about an important infectious disease, that is chickenpox, Varicella zoster virus infection. The organism is Varicella zoster. It has got two important clinical presentation. One is Varicella zoster infection, that is chickenpox. Another one is Herpes zoster or Shingles, that occurs after many years of initial chickenpox. Primary varicella zoster infection produces diffuse vesicular rashes all over the body, that is called as chickenpox. Endogenous reactivation of latent varicella zoster virus after many years of initial infection in a local dermatome is called as herpes zoster or shingles. Now we will see what way the virus spreads. The route of spreading is aerosol route. Like it is like any other viral infection. When the initial phase of this infection, patient can have some amount of cough, sneezing and all. Through the route, it will spread to another person. It can even spread from a direct skin contact. But this is not applicable for herpes zoster. This is only during the initial phase of the infection. Children, the disease is always mild. Adult, it is severe. Pregnancy and immunocompromised, it is very, very severe. So children, there is no need to worry. They may not have active problems. They may have mild skin infection. But adult and pregnancy immunocompromised have severe problems. Normal incubation period for this virus is 14 to 16 days. That means once you get an infection, after 2 weeks, the patient may have skin lesions. We will see the clinical features. Like any other viral fever, patient can have severe fever, back pain, eye pain, some respiratory symptoms. All these things are common. This is called as prodromal phase. Then patient develops skin lesions. That is mainly centripetal distribution. That means that skin lesions start in the trunk, then distributes all over the body, especially towards the limbs. If you see the patients of chickenpox, you can see all stages of skin lesion in this patient at same dermatome. So macules can be there, vesicles can be there, pustules can be there, crusted lesions can be there. So all these things can be there in the same area. That is an important clinical finding of chickenpox. Some patients develop secondary bacterial infections on top of these pustules. So that is very important. Patient can have secondary staphylococcal infection on these skin areas. Patients with chickenpox in pregnancy can produce congenital defects in infects. So that is very important. So chickenpox during pregnancy can produce congenital defects. So you can see here the patient can have ulcers, blisters, papules, macules, scabbing, all can be seen in the same area. Okay, that is very important for chickenpox. Now we will talk about herpes zoster. That occurs after many years of chickenpox. It's a reactivation of endogenous latent varicella zoster virus within a sensory ganglia. So that spread in a sensory route. Only one dermatome will be affected. But multi-dermatomal affection can be there in HIV, diabetes, immunosuppressive, those who are taking immunosuppressive drugs. All these things, all these type of patients, you can get multi-dermatomal herpes. Otherwise, it is mainly seen in a single dermatome. That is very important, especially on the face. That is the distribution of trigeminal nerve. Some patients can have on the chest. This is one of the common differential diagnosis for chest pain in emergency room. It's a differential diagnosis for myocardial infarction. Patient who is having diabetes present with chest pain, when you examine properly, skin lesions can be there on the chest. So they will have severe pain throughout the dermatome. That is a very classical finding. Now we will see what is the treatment for chickenpox. The early treatment is always better. If you delay the treatment, once the patient develops florid symptoms, then this may not work. The most important antiviral is acyclovir. So it is available in 200 mg, 400 mg, 800 mg. The dose is 5 times daily for 5 days. Normally in an adult who is having chickenpox, you can give 800 mg 5 times daily for 5 days. It can be used in pregnancy also. So it is safe in pregnancy. If the patient develops severe symptom, patient cannot take orally, you can give acyclovir IV. The dose is 10 milligram per kg IV TID. So you can calculate around 600 to 700 milligram IV TID is the dose. Alternative drugs are available for this antiviral, that is valacyclovir 500 milligram or 1 gram. Maximum dose is 1 gram TID. That is a routine adult dose. Famciclovir is another drug, 500 milligram TID can be given. So acyclovir 800 milligram 5 times, valacyclovir 1 gram TID, famciclovir 500 milligram TID. All these drugs can be used for 5 days as an antiviral in chickenpox. Patients who is having chickenpox should be given supportive therapy because they can have fever, they can have itching, they can have dehydration. So all these things we have to correct. So you have to give IV fluids, you have to give antibiotic like azithromycin for skin infection, antihistamine should be given, you can give chlorpheniramine malate, cetirizine, fexofenadine, all these things. Paracetamol also can be used whenever there is fever, body pain, but only thing, liver function test should be monitored when you are giving a paracetamol or aspirin. Rarely patient can have Reye's syndrome. So liver function test should be monitored when you are giving all these drugs. Now we will talk about vaccination or prevention of this disease. Varicella vaccine is available, 0.5 ml, 2 doses should be given. The first dose 12 to 15 months of age and the second dose 4 to 6 years of age. There is a dose for children. For adults, they should also receive 2 doses of vaccine at least 1 month apart. So it can be given along with other vaccination. Contraindication for vaccinations are very important. Whenever there is fever, you should not give any vaccine. Patient who is having HIV or immunocompromisation or those who are taking chemotherapy should avoid this. Then pregnant lady, you should not give vaccine. So these are the contraindications for vaccines. And there are a lot of interactions for vaccines when you are taking antiviral therapy, you should not use vaccine. Or when you are taking immunoglobulin, you should not give vaccine. So these are the contraindication for vaccines or interactions for vaccines. Now post-exposure prophylaxis. Suppose you are already exposed to a chickenpox patient, you are never taken a vaccine, then you have to go for varicella zoster immunoglobulin. Varicella zoster immunoglobulin dose is 125 units per 10 kg body weight. Maximum 625 units can be given. So that is a dose of varicella zoster immunoglobulin. If it is not available, you can give other IVIGs. So IVIG can be replaced for varicella zoster if it is not available. So that is for post-exposure prophylaxis. So we had discussed about chickenpox and its spread, clinical features and treatment protocols like acyclovir and vaccines, post-exposure prophylaxis. Thank you.